Excellencies, Mr. Chairman, ladies and gentlemen, let me start by expressing my gratitude to the organizers. I'm humbled and honored. Thank you for taking the initiative to gather us here. The onus is on us not to make it yet another conference, but one that will make a difference. As Margaret Mead said, never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it is the only thing that ever has. I'm going to start by restating why we're here, followed by the current status of basic infrastructure needs, and then focus my presentation on population growth as an opportunity not to be missed. Ethiopia will not be able to take other measures to curb this population explosion, but we can prepare our population, especially those between the ages of 15 to 64, for growth and development. I will conclude by focusing on what we can do to prepare the population. Ethiopia is projected to be one of the 10 populous nations in the world by 2050, along with the Democratic Republic of Congo, Nigeria, and Bangladesh, to name a few. I will not dwell on Ethiopia's achievements, and there are many. To name a few, the economy has been growing in double digits. 6 of the 8 Millennium Development Goals have been achieved in 2015. The proportion of people living below the poverty line has been halved, hunger and undernourishment reduced, access to education, including the narrowing of the boy-girl ratio, has happened, and child mortality has decreased by 2/3. Despite all these achievements, however, Ethiopia remains one of the poorest countries in the world. My job today is to tell it as it is and make all of us uncomfortable with the hope that this will propel us forward. This conference has been organized by forward-looking professionals who are concerned about the provision of critical infrastructure to the growing population. I must confess, I did not realize how dire the situation is until I started preparing this talk. For those of you who knew, please bear with me. For those like me, it is good to be reminded of where we are starting from. Over 44% of the population, they never make podiums for short people. I knew you could hear me. Over 44% of the population lives below the national poverty line, with 23% living on less than $1.25 a day and 78% living on less than $2 a day. It has one of the highest fertility rates and highest rates of maternal death and disabilities in the world. Women of childbearing age have a 1 in 52 chance of dying from childbirth-related causes each year. Every year, more than 257,000 children under the age of 5 die, and 120,000 die in the neonatal period. I wish the minister was here. Over 70% do not have electricity, including 24% of primary schools and 30% of health centers. Internet penetration is one of the lowest in the world at around 18%. Next door, Kenya, it's 90%. Only half the population has access to clean water. Only 15% have access to improved toilets. Right here in Addis, only 10% of the houses have municipal sewage access. The literacy rate is only at 39%, which is well below the least developed average of 77%. The urban population of Ethiopia is projected to triple to 15.2 million in 2012, 42.3 million in 2037, growing at 3.8% annually. The rate of urbanization now this thing is dead. These are the realities that we should keep in mind. Remember, I said to you, my purpose is to make all of you uncomfortable. Because if we know where we are, then we would know where we are going to go. The United Nations replaced the 8 Millennium Development Goals to 17 Sustainable Development Goals in 2015. These, to name a few, are no poverty, affordable clean energy, decent work and economic growth, industry, innovation and infrastructure, to name a few. I have highlighted the goals for health, education, clean water and sanitation. According to the government's own interim report, Ethiopia will not achieve any of the 17 Sustainable Development Goals. Many developing countries, such as Ghana, Rwanda, and Kenya, have made use of new technologies as a means to bridge health, education, and gender disparities. Even more so, Liberia has reached its microgrid of care that powers the last mile healthcare and connects it to higher levels of care as needed by using technologies and extensive solar energy. It can be done, and there are several examples here in Ethiopia as well. The point is, technological leapfrogging can be accelerated even faster if we get the basics right simultaneously. Simple technology can change lives. Kenya has been using PESA for banking. One needs some type of ID, a bank account, and a cell phone to use this technology. Those having all three are only 21% in Ethiopia compared to 71% in Kenya. Now Kenya uses e-technology for reaching health to its rural population. Using the past few slides, I have tried to show the state and limitations of the country whose population is projected to double to 2050. Planned carefully, the population projection may present a one-in-a-lifetime opportunity to lead to development, and that is what I would like to focus on in the remaining few slides. I like to start this section by acknowledging the extensive work that has been done by Professor Asafa Hayilemaryam and others. I recommend the slideshow the Ethiopian Academy of Sciences has put together, which explains population dynamics in very simple terms. Demographic dividend refers to countries with the greatest demographic opportunity for development and those who are sharing a period which the working age population has good health, quality education, decent employment, and a lower proportion of young dependents. Simply put, if you look at the population of Ethiopia in 2015, there are more people below the age of 15 and above 64 who are dependent. In 2030, you see the base of the pyramid shrinking and the middle beginning to bulge. Translation, the number of people above the age of 15 starts to increase and the population below decreases. More people in the workforce and less mouths to feed. By 2050, the working age population, that's 15 to 64, will be bigger than the dependents 0 to 14 and above 65. The dependency ratio of the ratio of the young, 0 to 14, and old, above 65, to the working age population will decrease from 77% in 2015 to 63% in 2030 and 47% in 2050. Countries such as Japan, South Korea, Taiwan, Singapore, Thailand, Malaysia, and Indonesia have used the demographic dividend effectively to grow, which became known as the East Asia miracle. Whereas countries in Latin America and other parts of the world who did not manage the demographic transition did not benefit from the demographic dividend. If the transition to the demographic dividend is handled properly, Ethiopia will have a chance to develop. If not, Ethiopia will be a land of destabilized societies and insurmountable environmental problems. A few points to note on this slide. There will be many young people entering the labor market over the next 20 years. By 2025, only 5 years from now, the number of the working age population will be around 60%, which will present a huge opportunity to diversify from rural to urban, industrial, and service centers. If not managed proactively, it may cause a challenge to cities to provide jobs, infrastructure, services, and housing. More importantly, a working age population, especially youth, needs to be engaged in nation building and not frustrated and used for dismantling nations and the rule of law. You can also see that duration of the demographic dividend is limited, which in the case of Ethiopia peaks at 2050 and starts to decline. It is expected that by 2050, 60% of all Africans will be living in urban centers. Africa is one of the fastest urbanizing continents. Indeed, it has been projected that between 2010 and 2050, 16 of the 20 fast-growing cities will be on the African continent. This is attractive to investors, provided there is indeed a productive workforce. These are the critical ingredients. Forgive me. There are critical ingredients to reap the benefits of the demographic dividend. To name a few, it is, first of all, somehow a slide is missing, in which case I'll pass. It is health, education, economic growth, and good governance. For those of you who know this gentleman, I'll come to it. So the first and most important critical condition is education. The working age population will make a difference only if it is educated and healthy. This guy is known as Professor Amartya Sen. He was the Nobel laureate for economics in 1998. He was asked a question: why India, which showed development before China, is lagging behind? His answer, he said, the Achilles heel of India is poor quality education, poor health, and skewed development policies. He said China invested heavily in education, health, and providing services to its rural population. Today, China has extended, for example, electricity connections to nearly the entire population, whereas a third of the population of India does not have any electricity, and yet electricity is government subsidized in urban areas, which shows the skewed development policy. We have two problems in Ethiopia as far as education is concerned. The first one is what's known as learning poverty. This is the inability of children not able to read and understand simple phrases by age 10. This is now identified as urgent as eliminating extreme monetary poverty, stunting, and hunger. Ethiopia's expenditure for primary education is 79% below the sub-Saharan average. This is one of the reasons for learning poverty. The second one, and related to the first one, is the deterioration of the quality of education at all levels. While there are several universities and colleges now, according to the World Education Review of 2018, none of our universities feature in the African-based universities ranking. I'm going to use girls' education as an example. One way of missing out on the demographic dividend is not focusing on girls' education. Girls' education should not be justified. It makes economic sense. If we allow girls to leave school early to marry for economic or cultural reasons, maternal and child mortality will increase with repeated pregnancies and child sickness and death, a sure way to poverty and insecure old age. If we keep girls in school by providing them with family planning, good healthcare, employment, good policies and laws to protect them, they will lead the society to a better future and development. The second one, incidentally, this was the slide which was supposed to come before Professor Amartya Sen, which shows the critical ingredients of the demographic dividend. In health, this slide shows you the interconnectedness of the 9 challenge areas to scale up healthcare. By getting access to clean water and sanitation, we take care of 60 to 70% of communicable diseases. Planned large-scale urbanization will provide jobs, housing, and affordable healthcare. Ensuring food security will result in well-nourished children to grow to a robust workforce. Dealing with sustainability and environment will decrease undernutrition by 50%, ensuring a future workforce. Dealing with the energy demand will provide access to new technologies for scaling up healthcare and reaching people in remote areas. STEM will provide Ethiopia with quality education and a skilled workforce in all areas. By increasing internet penetration and access to electricity alone, for prevention of both communicable and non-communicable diseases, vaccinations, and even intricate surgeries can be done in collaboration with outside institutions. In addition to job creation in all these areas, for the 15 to 64 age group, these synergistic areas will ensure Ethiopia's chances to reap the benefit of the demographic dividend. The third, and in my opinion the most important, is good governance. The last half-century in Ethiopia has been fraught with political upheaval and unchecked population growth, unprecedented poverty, and despite a 2-digit economic growth during the last decade, which has not been far-reaching and equitable. Economies cannot thrive in a country where there is no rule of law or transparency. In the BTI Transparency Index, Ethiopia stands at 113 out of 129 countries in all areas of good governance. I have a simplified picture of the components of good governance on this slide. There are enough examples of how to transition and make the most out of the demographic dividend. There is no lack of enthusiasm or bold ideas. In the last few years alone, when the situation in Ethiopia began to open up, even with the lack of basic infrastructure, we have seen many young Ethiopians who are trying to innovate and come up with new and bold ideas. However, their efforts are stifled because of lack of good governance and uncertainty. Instead of spending their time on innovation, they spend it going from office to office to cut through a maze of bureaucracy, or finding someone who knows someone to help them, or giving bribes openly. None of these initiatives will be scaled up to a level where it can make a difference. Whatever solution we come up with will not work without good governance. Most who have sold their life savings and came home to make a difference have been frustrated and gone back. A development program that started under one government will be destroyed when the next one comes to power. No one wants to invest in a country where there is no rule of law or uncertainty. For example, there are shovel-ready projects prepared by the African Development Bank called the Program for Infrastructure Development in Africa. One of the experts who prepared this document was telling me, investors get excited and go to Ethiopia only to find out that they will not get government guarantee to protect their investment. The two prerequisites for development, as I said before, are a healthy, educated workforce and with a good governance as a given. We need to create jobs for the youth now. Ethiopia is one of 10 countries that